But if you want more than just temporarily getting out of pain, then you need to learn something. If pain is stopping you from doing the fun stuff or the important stuff in your life, then you need to learn as much as you can about your pain so that you can discover a management strategy that works for you. You don't need to be prescribed a cookie cutter plan. You need someone to help you uncover a unique plan that doesn't require you to be 100% dependent on a healthcare provider, like a chiropractor, once a month for the rest of your life. You need a strategy rooted in evidence. This plan should be customized to your specific needs, and it must offer options and come with guidance. All of this requires education. Welcome to Build Beyond, a podcast designed to challenge and guide you on your health journey so that you can meet your full potential. I'm a healthcare provider, but I'm also a healthcare consumer. One of the most challenging things about being a healthcare consumer is picking your doctor. How do you make the right choice? Sometimes the choice is simple and obvious. If you have a fever, contact your primary care provider, who's usually a GP or a pediatrician. If there's trauma, call 911 or go to the closest emergency department. If you have a tooth problem, call a dentist. But if you're struggling with pain or disability relating to muscles, joints, or other physical injuries, how do you pick the right kind of doctor? Should you stick with your primary care physician or pediatrician? Should you go to the emergency department? Should you see a chiropractor or a physical therapist? Do you need an osteopath, an orthopedic surgeon, or a physiatrist? Maybe you need a podiatrist, a massage therapist, or some other specialty like acupuncture. Even when you select a specific profession, how do you decide between the different options within that profession? Because there are always different subspecialties within every healthcare group. Essentially, it's up to you as the healthcare consumer to make the best choice, usually with very little info at your disposal. I've heard this decision-making process described as the supermarket approach, where healthcare consumers are confronted with many different treatment options offered by multiple professions, subspecialists, and even commercial vendors selling products like supplements. In general, having options is a good thing. Still, the problem is that treatment varies a lot based on the provider or supplier, and your choice may be made based on salesmanship, marketing, or preconceptions rather than being grounded in evidence-based and cost-effective care. So, evidence-based, cost-effective care that is specific to your unique needs. Many people choose their healthcare provider based on recommendations from friends and family. Some people will only select healthcare providers who take their insurance. The choice is financially based. Others make choices based on proximity or availability. Some people look at Google recommendations. There are many ways to select a healthcare provider, and none are wrong. But at the same time, none of these ways appear to be ideal. When making these choices, I'll offer you a suggestion. When narrowing your options, consider the healthcare provider's willingness and ability to teach and guide, not just prescribe and treat. This may be something that you've never considered before, but I'd like to make a case for why it should be included in your decision-making process. Education is an essential part of healthcare, and it is often hindered or completely eliminated by time constraints. Short appointment times don't offer much time for nuanced discussions and education. Healthcare providers acting as guides and teachers don't fit well within a short appointment time structure. I know many healthcare providers who wish they had more time with their patients to offer education and guidance. Unfortunately, insurance reimbursements have a strong influence on doctor-patient interactions. Even though many healthcare providers want to spend more time on education and guidance, it can be hard to keep your doors open if patient volume drops because you're spending too much time with people. Interestingly, there are also many healthcare providers who don't value the education process. As a healthcare provider, I'll admit it's not uncommon to feel like you've heard it all before. But when this mentality becomes a habit, healthcare providers tend to ask fewer and fewer questions based on the assumption that they know what's best for you because of their experience. This is a natural tendency that all healthcare providers battle. I've had some interesting conversations with other chiropractors regarding the importance of patient education. And although all of the advice I've received from other chiropractors has been well-meaning, much of it has been disappointing. When we look at published recommendations for managing muscle and joint pain, these recommendations are usually broken down into different categories. should do, could do, don't do, and uncertain. Should do recommendations are those that should be applied in all circumstances unless there is a rationale not to. These are based on strong evidence, such as multiple high-quality studies reporting clinically relevant positive effects. Could do recommendations could be applied depending on the circumstances of individual patients. They are usually based on consistent evidence from multiple lesser quality studies. Here are some should do recommendations from a systematic review published in 2019, and I will list this paper in the description. Care should be patient-centered. This includes care that responds to the individual context of the patient, employs effective communication, and uses shared decision-making processes. All patients should be provided with education and information about their condition and management options. Patients should receive management that addresses physical activity and/or exercise. If used, hands-on therapy like back cracking should be applied only in conjunction with other treatments. In this specific paper, where they compared multiple studies, hands-on therapies like chiropractic adjustments were a could-do recommendation in 7 studies and only a should-do recommendation in 1 study. This is interesting because chiropractic adjustments tend to be the centerpiece of traditional chiropractic care, even though current guidelines regard hands-on therapy as merely a could-do option. One phrase that different chiropractors have said to me multiple times is, "Don't forget what you went to school for." Now, every time I hear this phrase, the chiropractor saying it holds up their hands like this. This hand gesture always accompanies this phrase. Why am I bringing this up? Chiropractors tend to, stereotypically, put most of their emphasis on hands-on therapies like back cracking, for example. Appointment times are generally short, and patient education is limited. Exercise and/or physical activity recommendations are stereotypically delivered with less emphasis or in a pre-programmed manner by a chiropractic assistant who is usually just reading a script. While it is true that chiro means hand and our profession was founded based on hands-on therapy, I disagree that my hands are my most valuable asset. Actually, far from it. It's funny because I've had other chiropractors tell me that I can't be successful if I don't fully embrace chiropractic philosophy and become world-class with my hands. Chiropractic philosophy is interesting. Chiropractic history is interesting. But I don't want any healthcare provider treating me or my family based on philosophy and old theories. Improving hands-on therapy skills is a great idea, and I completely support the concept of skill development. However, I don't know of any credible evidence suggesting we should use hands-on therapy as a primary treatment method. Nothing seems to indicate that hands-on therapy should be the centerpiece of a treatment plan. At best, manual therapy is as good as anything else for managing pain, including placebo. Chiropractic adjustments can be effective for short-term relief, but joint manipulation, independent of the other should-do recommendations, does not appear to be a viable treatment strategy for long-term results. Cracking backs, massaging muscles, releasing fascia, lasering joints, and all the other passive therapies can be great options if you're trying to take the edge off of pain while you're working through a recovery strategy. However, these options are best used as adjunct therapies within a more comprehensive treatment plan. So, what should be the centerpiece of a treatment plan for joint or muscle pain? It appears that a quality treatment plan should be built on a foundation of education. Pain management tools, like chiropractic adjustments, could be helpful. But if you want more than just temporarily getting out of pain, then you need to learn something. If pain is stopping you from doing the fun stuff or the important stuff in your life, then you need to learn as much as you can about your pain so that you can discover a management strategy that works for you. You don't need to be prescribed a cookie cutter plan. You need someone to help you uncover a unique plan that doesn't require you to be 100% dependent on a healthcare provider, like a chiropractor, once a month for the rest of your life. You need a strategy rooted in evidence. This plan should be customized to your specific needs, and it must offer options and come with guidance. All of this requires education. This is why I don't agree that a chiropractor's most important asset is their hands. It appears that we should, first and foremost, be educators. Secondarily, we could offer hands-on therapy to help supplement the larger treatment plan, which should be built on a foundation of education, largely incorporating physical activity, which is commonly referred to as rehab in a clinical setting. I'll offer you this quote from Monty Roberts. "There is no such thing as teaching, only learning. Knowledge cannot be pushed into a brain, it must be willingly drawn into the brain by the recipient." For example, everyone knows we should exercise and eat healthy food. This is common knowledge even for those who struggle with obesity, diabetes, and heart disease. But how effective is it to tell a person with obesity, diabetes, or heart disease that they should diet and exercise? They probably know this already, and even if the concepts of diet and exercise are news to someone, how effective is it to simply tell a person to eat better and get a gym membership? These words alone are not teaching them anything and are unlikely to change their behaviors. So think about this quote again. There is no such thing as teaching, only learning. Knowledge cannot be pushed into a brain, it must be willingly drawn into the brain by the recipient. Now, let's apply this concept to a healthcare setting. If you need to make changes to accomplish your health, pain, or physical activity goals, you must be willing to learn. You need to be receptive and open to change. Here's another example. A lot of research shows that people who increase their strength and their muscle mass have better health outcomes. A 2019 study suggests that people who can do more push-ups have a lower risk for heart disease. Now, why should we care? Because heart disease is the leading cause of death worldwide, and studies have suggested that physical activity provides heart health benefits and is associated with a lower incidence of multiple diseases, including heart disease, diabetes, cancer, and Alzheimer's disease. This study found that push-up capacity was inversely associated with a 10-year risk of heart disease among men from 21 to 66 years old. Push-ups are a simple, no-cost measure that may provide another way to estimate the functional status of middle-aged men and assess their risk for heart issues. Participants who were able to perform 11 or more push-ups at baseline had significantly reduced risks of heart issues. Participants who were able to complete more than 40 push-ups were associated with a significant reduction in heart disease compared with those completing fewer than 10 push-ups. And I will link this paper in the description if you're interested in reading it. So there you go. Can you do 11 to 40 push-ups? Most people can't, and that's okay. However, as this paper mentioned, push-ups are free, effective, time efficient, and require no equipment. So here's what I just taught you. Heart disease is the #1 killer of men and women worldwide. Push-ups are free and may significantly reduce your risk for heart issues. Did I actually teach you by giving you this information? Maybe, but probably not. Because, as I said before, the concept that exercise is good for you is common knowledge, yet most Americans don't meet physical activity guidelines. Assuming that this push-up data is accurate, is this information powerful enough for you to start training push-ups every day? If not, why? Because that's not how humans work. Simply telling someone information does not mean that they learned anything and probably isn't going to change their behaviors. If teaching people stuff was effective for behavior change, then heart disease would be less of an issue and most people would be able to perform 40 push-ups. For those who truly believe that people should just have willpower and then make the obvious changes, I'd ask you, how many push-ups can you do? Is this info strong enough to change your life? No. For most people, it's not. I'm teaching you, but you didn't ask me for a lesson. I'm not working with you right now. I'm just talking at you. So, I will suggest that healthcare education in the form of pamphlets, Brief recommendations or scripted material delivered robotically is not effective education. These delivery methods probably qualify as teaching, but do not usually change behaviors. So there is no actual learning occurring. I suggest finding healthcare providers who work with you and offer you options. I also believe that you must be open to suggestions and prepared to learn and act based on what you learn. Glancing at a pamphlet and thinking about diet and exercise are not strong enough actions to avoid things like heart disease and diabetes. Being taught is not enough. You need to learn and demonstrate what you've learned through action. That is the only way to bridge the gap between information and actual health outcomes. There is a difference between informing and advising, and the line between them can be blurry. What matters most is how you hear and receive the education being offered. Education in healthcare is vital. It's one of the most important things we can offer as healthcare providers. But learning is a two-way street. There is no proof that learning has occurred unless someone tries to put that information into action. In a clinical setting, rehab teaches people what they can do for themselves. Teaching occurs, information is willingly drawn in, then physical action happens based on that information. Feedback is offered, questions are asked, answers are given, and then more physical activity is performed. This is the learning process. This is how education works. Healthcare rooted in education is a process of guiding people and helping them develop the skills to not need as much healthcare in the future. So, I recommend that you seek healthcare providers who believe in education and set up their practices so they have time to educate and guide. I also recommend that you enter the healthcare environment with an open mind and an eagerness to learn. You must be ready and willing to draw in new information, get rid of old information, and actively participate in your healthcare. You can't learn unless you're ready and willing to learn, and you can't change without learning. Education and learning are paramount in healthcare because learning involves patient participation, and then patient participation builds skills, confidence, and autonomy. If you pair a person eager to learn with a healthcare provider excited to educate and guide, it's hard not to succeed. You can overwhelm the problem with an excellent solution. I hope this podcast was helpful. Thanks for listening.